So open enrollment for affordable health care is this week, Tuesday. People are scrambling, trying to find answers. It's a pretty confusing thing. So here to talk about open enrollment, everything you need to know about the new health care laws, Stan Williams from Arizona's Enroll America. Thanks for joining us this morning.
Thanks for having me.
This is a pretty confusing thing. So first and foremost, who needs to enroll?
It's a great question. So if you're one of the about 240 million Americans who have health insurance and you're happy with it, Tuesday's going to come and go, and it's going to be a little boring on the health insurance front because nothing changes. If, though, you don't have health insurance, or if you're not happy with what you've got, starting Tuesday and going all the way to March 31st, the health insurance marketplace is available for folks to find a new affordable plan that fits their needs. All of these plans have to cover the basics. Financial help is available based on your income, and you can talk to an expert for free to compare the plans in plain language and find what works for you.
March 31st, that's the deadline for everybody to enroll?
Absolutely.
Okay, so let's talk about being able to shop around. Say, you know, someone like me, I've got health care here through the station, but I could look elsewhere if I wanted something and maybe save money that way?
You can. So the marketplace is available for everybody. Now, if you do have coverage through your employer, but you choose not to use it, you may not be eligible for the financial assistance within the marketplace, but you can probably find a plan that works better for you. A lot of companies are taking advantage of that. You know, the plan that they had for their employees didn't really work for all cases, so they're letting their employees go to the marketplace and get that tax credit and help them in other ways.
What would you say is the easiest way for people to find out and shop around? You know, it just seems like there's so many different options out there, and it's so time consuming. How do you get somebody to walk you through that even?
Well, that's a great question. You know, here in Arizona, we're finding that our plans are some of the least expensive across the nation. And we have 106 options within our marketplace, which is great having those options. But you're right, it can be confusing. So there is help available. You can go to getcoveredamerica.org to find some of that local help. These are navigators and certified application counselors. They'll sit down with you and look over the plans, talk with you about your family, income, see what works for you, and help you make the right choice.
Last one, what would you say is probably the biggest misconception about the healthcare law and making a switch that people really need to know?
Well, I think the best thing folks can do is get that local help. Go talk to a navigator. Whatever your questions may be, you have that professional help available for free to look at all of the options and see if something works for you and what tax credits might be available to afford it.
Okay, wonderful. Thank you so much for joining us this morning. And I believe we have those links on ABC15.com to keep you covered on our website.